I'd now like to move on and introduce Dr. Rafa Bengoa, who has been the chair of the commission, the TSA ADAS Commission, and is co-director of the Institute for Health and Strategy in Bilbao, Spain. Every now and again in one's professional career, you meet somebody and you think, gosh, this man has got huge amounts of experience, insight, and wisdom. And when I first met Rafa, that was exactly the thought that I had. So it's a huge privilege for me to introduce you, Rafa, and for you to be able to give us your insights and thoughts. So I introduce you, Rafa. Thank you.
Thank you very much, David, for that kind opening. I think I'll be probably repeating some of the things you've heard from the four speakers this morning. And when you actually see the report, you'll see much more detail than what I'm about to put across, which is basically for you to have a feeling and for you to want to read this report from this commission, which I've had the honor to chair. I think what we've tried to do in this ADAS TSA commission is to go a bit deeper into the how, building on the previous reports that you've just heard about. And we've tried to say more about, okay, who and what and when should somebody be doing something to go in the direction that we've just heard about. The second point I'll come back to it at the end, but basically I think it's important to know that all of Europe, whether Brexit or not, Europe is, everybody has had the same problem, the same headaches in relation to social care. Everybody is seeing the potential of technology as one of the elements to improve on. You'll see little by little, for example, the Danes are calling live your life at home, basically, is what they're calling their new social care movement. So everybody's trying to move in this direction, but what's interesting about this commission and what I'm hearing today and what I've learned these months working with you is that you're ahead strategically in England, because you're taking time to think strategically what has to be done, while of course we're all fighting the virus fire at the same time. So next slide, please. I think we all are conscious that the time is now. COVID has normalized digital just about everywhere in many ways. We've just heard that social care is facing huge pressures and that technology is going to be vital to its sustainability, but we need a business case to make the case to government, so that is the way forward. Truly integrating technology with social care is still missing in many parts, and in this case in England it still eludes most parts of England. There are fantastic better practices here and there, and you'll see them in the report, and you've heard during these 4 days, you'll hear many more, but obviously they need to be joined up and scaled up. We've tried to identify barriers and how to accelerate, and what I was mentioning before is that we try to be as howish as possible. Next slide. We've spoken to many people. You'll see the names there of people who have been actively connecting, but then we've connected to people in frontline professionals and leaders in local government, housing and health and technology suppliers and directors, of course, of adult social care, and some of the examples from families and people, vulnerable people. Next slide. What we learned very briefly, is something that is, of course, something present in everybody's minds that is participating in this conference, but that we are obviously not patient-centered enough. There's not sufficient personalization, and we think technology obviously can help very much in the journey towards personalization. People must own their data more and more, and co-production is one of the tools to make that operational. In terms of infrastructure and skills, what we've learned is that there's a big legacy effect of 20th century technology, of course. The shift toward digital obviously will increase connectivity, but it must be done, as we've just heard, with the right focus, with the right outcomes in mind, and not just because it is interesting to connect. The digital skills must improve, both individuals and workforce, and shared data platforms and collaboration tools are needed. In relation to data, access to up-to-date care records is going to be key in both social and healthcare. Sharing that data will obviously improve outcomes, and it was interesting to listen to Andy Bagley now showing how you can sort of ladder your way up there, just starting with 2 and then 3 data sharing groups. And then the perceived risks that there are behind data sharing must be rebalanced in relation to a lot of the perceived risks that people have in mind. And then, of course, in terms of collaboration, some very interesting things, of course, are happening in England in relation to integrated care systems, the links with housing, etc., which are very, very interesting, because if cross-agency work can be pulled off effectively, obviously, we're going to be able to have the elements to be able to have place-based care, etc. And then finally, what we learned on data gathering across different organizations is still a major hurdle. But I think most sectors are moving in the same direction that we are talking about in these 4 days, and therefore it should be possible to align things as we move forward. Next slide. So we had a sort of general vision about adult social care, about in general, the main thinking, of course, is to try to put much more power into the hands of the people so that they can choose and control the support they want, and that we think technology can obviously enable this family and carer empowering, and the development of community networks with technology is probably one of the best ways to achieve that vision. Yes, next slide. The recommendations are chunked up in 4 areas, and each of them have some very specific hows, which I won't go into because they're in the report, but basically there's a battery of recommendations, many directed towards government, many directed towards local government, many directed to technology providers, etc. But the first group was this, that the technology-enabled systems, of course, must be much more proactive and co-produce with people, as we mentioned in the vision. The second area is around making sure that we develop a much stronger digital infrastructure with the skills and approaches for adult social care, for both individuals and healthcare workforce. So there's an important investment there. I think that's relevant, of course, for many countries, but in this case, it's important to signal that the care workforce is not there yet, and that one must also improve the skills and approaches there. The third area is people must own and control their health and social care data. I think we just heard a lot about that, and we tried to signal some of the hows that would take us in that direction. And of course, the joined up agenda with what is just about to happen with the ICSs in England, which I think is way ahead of Europe in many, many ways in relation to where you're going in this case in healthcare, and hopefully joined up with social care in a pragmatic and coordinated way, and of course with housing, which is such a key actor in this area. Next. So we're recommending a sort of implementation plan, mainly I think to government, where you have several stages, but the idea is to end up with a identifying effective services and technologies, and making sure that one can then in these 7 or 10 regions where we're proposing to implement personalized care innovation programs, one can be experimenting with data sharing, reinforcing infrastructure, as we've just mentioned, and little by little end up with a business case that will convince government that there is a case to deploy nationally examples like the ones that would be set up in these 7-10 regions that we're implying, and we're suggesting that that should be financed so that it is deployed as quickly as possible, much more rapidly than the same sequence which has happened in healthcare, which has been very positive but has taken many years to get to the ICSs. But as an example of how to move forward from these personalized care innovation programs, we are recommending to go very, very fast. Next. And then just to end up saying that, as I mentioned at the very beginning, most European countries have not yet begun sufficient strategic thinking around where they're going next with social care and technology. But I think this is going to be picked up very quickly. And I think this commission and the things that we're hearing in this conference are obviously going to be a big influence in Europe. Whether one is in Brexit or not Brexit, it is evident that knowledge is going to be circulating anyways. And so I think, for example, the business case that's going to be built up in England, if we move forward this way, will be very interesting for other parts of Europe. Everybody has the same legacy problems and the data sharing problems and the insufficient integration between different sectors. Let me just say that finally, we know that from the recovery funds that have been decided in Europe, which are a massive amount of money for European countries, 20% of that is going to go into digitalization of countries. And a good chunk of that is going to have to be used strategically in health and social care. So it seems reasonable to start connecting the learning in England with the learning in Europe in a few months' time, so that we can all move forward together. Thank you very much, David.
Rafa, thank you for your presentation, and indeed for chairing the commission with such skill and perception. I wondered, in this, it was quite a complex piece of work, pulled it together, and as you say, we very much hope that it will provide a guide and a roadmap for the future. What were the two, I suppose what I was thinking was, what were the key things that struck you as you were chairing it as the things that really must that you would emphasise to the conference need to be addressed in order to make progress? If you think about both the either from a barrier or an opportunity point of view, if you could just perhaps highlight a couple of things, 2 or 3 things for us.
Yeah, I mean, I think the main one is let's say the strong idea of empowering people so that they are creating with technology in this case, but the care process that they need and want. I think this is not interiorized in most of the countries I know as something which should be more and more in the hands of the people that need care. The second one is how interesting it is to start, of course, bringing together in a coordinated way health and social care around place-based systems. And then the third one, David, is obviously the fantastic pragmatism, which has made me learn a lot about implementation. I think there's something Anglo-Saxon behind this idea of being extremely pragmatic. So as we were moving forward, everybody was saying, "Yeah, but how are you going to do that? But how are you going to do that?" You, among others, saying, "Okay, this is not sufficiently how, so let's get the how." So that's very powerful in terms of then being useful for governments. Because governments, I think many places know where they have to go, what they have to do, and why, but they don't take sufficient time on the house. I think there's many hows here that they could just bring into their decision-making processes.
Yeah, that's very entertaining. Thank you, Rafa, and for the insight into the Anglo-Saxon way. That's very entertaining. And I'm struck by your point about having information more in the hands of the people themselves. Your first point, and I've heard George Crooks talk about this passionately for some time. Have you come across anywhere in the world where people do this well, or you think they're ahead? And what do you think the potential is for that?
Well, there are pockets, for example, in South Denmark, and George knows that. George Crooks knows that very well. It's what I was mentioning at the beginning, what they're calling live your life at home. They're making it into a reality in South Denmark, and with a very ambitious approach to technology use and data sharing, etc. So I think that has been taking shape, and obviously then in other sectors. The difficulty I'm seeing, at least from my country in Spain, is that things that have happened in terms of empowering people, whether it's in banking or in industry or whatever commercial activity, that knowledge hasn't moved over to health and social care in many countries. And it seems to have taken shape in, of course, other industries before ours. And that's quite extraordinary, because actually where it should be happening first is obviously in health and social care. So that's why I think there's a lot of knowledge sharing that we should have among European countries as we move forward to see what we've all learned in relation to this journey.
Sure. No, I completely agree with that, and we must work to create the opportunities for that to continue to work to make the opportunities for that to happen. So, Rafa, I'd like to thank you very much indeed for your again for your chairing of the commission, and for your presentation for this morning, and your overall your work with us, which is fantastic. So thank you very much indeed for your
Thank you, David.
contribution this morning.